Hello, it is Menopause Awareness Month, and many of you might think, well, why do I need to know about menopause? It's not relevant to me. But the answer is it's relevant to everybody, because everybody has some degree of contact with someone who is either menopausal, perimenopausal, or about to go into menopause or in menopause. So understanding what happens, what impact it has is all really, really important. So I've got a compilation coming up after this that will tell you exactly why you need to know all about it.
And I was diagnosed with bipolar disorder. No one mentioned perimenopause at any point, nobody. And I saw lots of doctors. Given a bipolar diagnosis, 47.
Right.
Bipolar diagnosis.
And you'd never had any psychiatric history?
No psychiatric history. I'd never, to my knowledge, suffered from depression or anxiety. And I was so depressed at that point. I mean, you know, teetering on the edge depressed, as anyone who's experienced that will know, you know, way, way beyond sort of sad but properly hopeless. And I was given medication and quite a heavy duty medication for bipolar.
What were you
Lamotrigine, which at the time was a trial drug for bipolar. At the time, it was being used mainly for epilepsy. So they had tried me on lots of different SSRIs, and nothing had much sort of worked really. So I was put onto lamotrigine, and at the time I was on a couple of other things as well as the lamotrigine. And after 6 weeks, off I went with my bag full of bipolar medication, misdiagnosis, thinking everything's going to be fine. And
did you feel better at that point?
Well, I did, but not so better that I didn't have another mini collapse about 6 months later. So I went back to normal with my bipolar medication, still nothing being addressed about my hormones. And then had another kind of mini version of it about 6 months later. And that was the point at which I started to get some help with my hormones. And again, it was just a family GP who luckily was on the case. Complete luck in a really busy London practice. And I know GPs are sometimes the last to be able to help. Sometimes they do help. And then we started to unpick it a bit. And I then realised that what that collapse was about was perimenopause, I would say, in first position, and then looming empty nest and burnout in second and third positions. So, but it took me a long time to get off the statistics around how many women are getting diagnosed with bipolar disorder are pretty alarming, as you'll know better than most. And it took me a long time to get off the bipolar medication because I was terrified. And people kept saying to me, including my therapist, I don't think bipolar is the right diagnosis for you. So it was being questioned not least by me. But it took me a long time to settle onto my HRT, think maybe I'm not bipolar, maybe I don't need this medication. And, now all my medication is bioidentical HRT. That's the medication I'm on. That's it. Nothing for any psychiatric disorders. So yeah, I guess the headline of that very long anecdote is to say that yes, my perimenopause was misdiagnosed as bipolar disorder.
You just don't know what the hell is going on. I would have moments where my brain fog was terrible. I thought I had a brain tumour. I couldn't remember sometimes my surname. I got in the car and I couldn't remember which side of the road to drive. It just literally wasn't in my brain. And no one had said to me, you might be going through perimenopause.
Did you know? Did you know what was happening to you?
No, I went to the doctor about the brain tumour. So I said, I've got something really wrong with me. I can't remember anything. I'm going to work and I'm in meetings and I'm wondering why I'm there. I've either got early onset dementia or there's something really awful going on. And
that must have been terrifying.
Well, it was terrifying. It was, because I'm quite a sort of straightforward, logical person. And I'd worked in women's journalism and I still hadn't picked up on it anywhere. It was only when I talked to my co-host on the podcast, Trish Halpin, another magazine editor. She said, oh, well, we both got a brain tumour then. We can't both have one. We can't both be mentally unravelling like this. And, it's confusing, isn't it? Because there's so many things it could be at the same time as what it probably is, perimenopause. And I didn't have hot flushes in the day, so I just ruled out menopause because that was the only thing I knew. But I was then offered antidepressants. I was told this was a kind of... it's something mentally happening to me, and I was clearly depressed, and antidepressants would probably put me on a level I'd be able to do my job properly. I was literally writing things on Post-its and sticking them all over the wall before I left the house because I couldn't remember, even if I looked at my phone in my diary, I couldn't remember where I was going, what I was going to do next. And then I had a panic attack. I was starting to have panic attacks because when you lose your memory, you don't really know what's going on. You really feel quite frightened. And at that point, I thought, this can't be depression. No, I can't, this must be something physical. But even so, it was sort of I just said, I don't think antidepressants is right. I'm going to do some research on it myself. And that's obviously when I discovered perimenopause. Trish and I started to look into it and discovered that actually there was probably something that could help us.
Hi, everybody. I have something to share with you. So I started the podcast with the aim of being able to share as much information with you for free about menopause, perimenopause, midlife health, other women's experiences. And the whole point of it was to be able to offer something to anyone and everyone. And so on the back of that, and for Menopause Awareness Month, which is October, we are going to be able to offer a complimentary appointment at Menopause Care with one of our clinicians every day for the whole of that time. To be considered, just click on the link in the description.
I spoke to someone the other day. This makes me really sad. And she's 47. She says, I'm old. And I said, you're not old. You're 3 years younger than me, and I'm not bloody old. I'm fantastic, and I'm grateful for having lived half a century. What an achievement. And she said, I'm just so tired. I'm just so sad. And she was emotional. And life hasn't gone the way she wants her life to be, but she works hard and she's proud of her children. And I just said, have you thought about talking? She was describing her symptoms and her feelings and what's going on. Said, you do know you could well be perimenopause. And she said, I started when I was 40. And I said, so are you taking HRT? And she went, from where I come from, we're stoic and we put up with it. And I just went, there is absolutely no need for you. That is not stoicism. That's just you're not helping yourself.
Losing years of your life.
Yeah, exactly. And it's so interesting because I think it's a rarer attitude, but I do think there has been that attitude that you don't. I didn't want to enter perimenopause. Because there are still these myths that you're old, shriveled up, no use to society and all that. And of course I don't believe that now, but you still kind of want to stay youthful and kind of be proud that you're not perimenopausal, that your body isn't changing. But I found that really sad, and I'm very accepting of it, and I intend to take out HRT for as long as I need it and protect myself.
Did you manage to change her mind?
She's booked a doctor's appointment. She booked it. I made her promise me she'd book one either that day or the next day, and she's done it.
Oh, brilliant! Yeah. So you're making changes everywhere,
but also just being able to speak about it.
Then I did go to the doctor, and I told him this was how I was feeling. And this was just a normal doctor down the road, my local surgery. And he said I must be depressed, and he put me on antidepressants. I knew I wasn't depressed as that in that traditional depression. I felt there was something else going on. So I did take the pills, and I felt like it was a bit of a cop-out. And I was just a bit like frustrated with myself, frustrated with the doctor. I just felt like this wasn't the answer I needed, but I did take them for a very short time. Very short time.
Did it make you feel any
Not
better?
really. No. Not really. It didn't really do anything. That's why I just thought these aren't helping. There's something else going on. And George was really instrumental in that too. He was like, I just don't think you're depressed. I think that there's something else going on.
The trouble with antidepressants is they have a role. They have a brilliant role in depression, in the treatment of depression, but they are not first-line treatments for perimenopause. They won't cure all of the symptoms that are associated with perimenopause. And it's so disheartening to hear that so many women are offered that first when they should be offered HRT as gold standard. And that's something else that we really need to help impress on the medical profession, because they are, especially the generation of doctors that are perhaps a little bit older and practicing now, having been trained in the days that HRT was not used so much, is they're much more comfortable prescribing antidepressants. It's a safe treatment for them, whereas they might still be concerned about the risks of prescribing HRT. And we need to flip that on its head.
Because it is still, so many of the older doctors, it's demonized still, from the early 2000s, where they are scared to prescribe it. I don't blame that doctor at all, because back 11 years ago, I went into that doctor's surgery and I broke down in tears. So to him, I looked like a woman who was depressed.
you know, so I don't blame him at all. And I also think that there is a place for antidepressants that sits alongside HRT, because sometimes women get so low and so completely at their wit's end that just to balance everything out, you need a little bit of both. And so there's no shame in that at all.
Absolutely.
No shame in whatever you need.
That's a really good point. That is a really good point. So I think it can swing the other way, where people are saying, don't give antidepressants. Antidepressants are the wrong thing. Antidepressants are terrible. They're not. They just, everything has their role, and it's about prescribing the appropriate medication to the right patient. It's just about individualized, appropriate care.
One of my followers said to me that her doctor said she couldn't have testosterone because it's a male hormone. And she was told by her friend to go back and say, actually, my marriage is on the rocks because I'm not giving my husband enough sex. Therefore, can I have testosterone now? And he said, yeah. And I'm like, wow, it's 1958, guys.
I know, it's amazing. And you hear about women who are refused testosterone because they are single.
Oh my God.
I heard that somebody told me that. Somebody told me that was their experience just in this last week. So, yeah.
Boy, she's single, ready to mingle, surely. You'd need more sex drive, definitely more than me. I'm watching Netflix.
That was her doctor's response. Yeah.
That's so triggering.
Menopause is that last barrier to getting more women to stay in companies, because if we support them better and understand them, women don't want to be having time off for their menopause. They just want to be better understood. They've worked hard to get to these places, whether it's the manager of a company, whether it's the top cashier in the company, or it doesn't matter. You've earned your place there, and you want to be thriving. You want to be working. So, do I think women are still leaving the workplace? Yes, I do. Do I think that's because we don't know enough about menopause? Yes, I do. But do I think it's a business issue in terms of HR and that? No, I don't. It's a people issue. You know, I don't want companies just putting managers through a menopause program to see how they need to manage a woman in their team. I want businesses to talk about menopause so that actually it's a people issue, that you learn it, you take it home, you realise that's for your wife, that's for your partner, that's for your friend, your lover. It's also for your work colleague as well. Let's make societal change by, rather than, you know, when you're forced to go on programs, it feels like it's pushing you somewhere. You know, it's like law. If you make it legislation, it feels very fearful. Whereas actually these brands and companies should be doing it because it's the right thing to do, not because they've been forced to it. So I do think that, back to your question, do I think more women leaving? I think it's not changed. But I actually think it will change. We allow women to feel better supported, give them the aspiration to thrive as well. And please don't get me wrong, I don't want him going, I've wanted the aspiration to thrive, but I can't. Sometimes we've just got to actually push our aspiration further and put ourselves number one and value it, and actually take no shit from anyone and get on with making your life the best it can be.
If any of these ladies' experiences or situations resonate with you, then please do watch the full episode that is out on YouTube and Spotify. And if you're looking for more information about menopause, libido, testosterone, other types of HRT, anything to do with perimenopause and menopause, then I have lots of information on my Instagram, which is Dr_Naomi Potter, and also on my clinic website, which is menopausecare.co.uk.